The topic today is LGBTQ Youth Mental Health. And when I'm talking, sometimes I'll shorten that and drop the Q because it's easier to say. Okay, it's a mouthful when you add the Q, and it's not because I don't think it's important. I think it's quite important to talk about each element of this, which we'll get to in our talk today. So as the person who introduced me said, I'm Melissa Deuter. I'm a psychiatric physician in Texas. I've worked in private practice in the state of Texas, in the community of San Antonio since 2004. And the work that I do now is a combination of care ongoing with people I've been seeing for years and walk-in care for people who don't have the care that they need to keep them out of the hospital and to prevent the gap that exists in mental health care. I also have a special interest in getting people out of the mental health care system, both by getting them well and also by things like providing reassurance rather than treating everyone as if they're very ill, which I think is a problem in the field of psychiatry at this time. And we'll touch on that in places. So this is our contact information. It's in your slides, so if you have a copy of the slides, there are websites there. One of those websites is to the urgent care clinic, and the other is the website that connects to my blog and has information about the book that's a lot about getting people restored to health and back to living rather than stuck in the role of a sick person long term. Okay. So LGBTQ mental health, right, and particularly as it applies to youth is our topic today. And so the first thing I'd like to talk about is what do all of those letters stand for? And I think sometimes people take for granted when we spit out LGBTQ that they know who we're talking about. So I just want to define that as it's defined by the LGBT community themselves. So L is for lesbian, which are girls who love girls or women who love women. Gay is men who love men or women who love women. So that's used both ways. Bisexual is people who may love or be attracted to the same gender or the opposite gender. Transgender, which is a very politicized topic. And so I think it's really timely that we're having this discussion because transgender in general centers around the idea that certain people are born with one gender in terms of their body's anatomy and their structure, but they have the identity, the feeling that they belong as the other gender. And then queer and questioning, which has been adopted over time. As LGBTQ sort of became the nomenclature, there were a string of other letters and still are. But the Q for queer and questioning covers a lot of those other groups. I think it's fair to say that there are many, many additional letters because people's sexuality and their sexual attraction is often unique. Many people don't fit neatly into categories in the ways that we've liked to think about them in the past. Okay, so, you know, why are we hearing about this so much? Obviously, the bathroom bills came up in our political system, and that's been something that's been talked about. And one of the things that I hear in particular, so I lecture at the medical school to the psychiatry residents and to some nursing students, to some PA students and different groups. And I hear from them, particularly the less experienced folks, they say, is this new and is this trendy? And that's a question I get a lot. It's even a question I get in clinic from parents who have children or adolescents, for example, who are questioning. And they say, but don't you think that the reason this is happening to my child is because it's trendy and they're hearing about it from other kids at school, or they're hearing about it even in the news, or it's kind of in, okay? And so I'd like to address that. So is it new? So no. There's a lot of research on this topic. This is not my personal opinion. There are reams of data that show us that this is neither new nor trendy. So the rates of homosexuality and transgender have been relatively stable for the period of time that we've had research to show us what those rates look like. And so is it trendy? So I think the discussion is probably a trend. There's certainly been a rise in the discussion as there's been a rise in political advocacy for the rights of people who belong to this group. But in reality, it's an increase in public discourse but not an increase in the rates of these issues in our populations. And so that's really an important thing for us as educators or as clinicians to reassure families when they say, you know, is this a trend that my child is joining, particularly when we're dealing with kids, to reassure them that it's not the case at all. Okay? And so this is a really common one, and this came up with the new edition of the DSM, the Diagnostic Manual for Mental Disorders. When the new edition came out, which finally happened in 2014, it had been predated by a whole lot of debate about whether or not these issues belonged in the DSM at all. And so the question is, you know, is LGBTQ a mental illness? And if it's not a mental illness, then why are we talking about it at a conference on mental health? And so, is being LGBTQ a mental illness? No, absolutely not. And even the people who wrote the criteria for the DSM held very strongly the belief that transgender or gender dysphoria, which is the nomenclature in the DSM now, is in fact not a mental illness. And so then part of the question is, well, then why is it there? And this is something that I see people debating in the public, particularly on social media, quite heatedly. And the answer is that in healthcare in the United States, in order for healthcare services to be covered, there has to be a diagnosis. Now, that's not the case everywhere, but that's the case here. So when people have counseling services or, for example, gender reassignment surgeries and so forth, there are treatments that include psychological counseling that are required in order to go through the steps that a transgender person might go through for gender reassignment if they choose to do so. And so part of the reason that transgender or gender dysphoria or any of these issues remain in the DSM is for insurance coverage for those individuals. If we gave them a different diagnosis, for example, anxiety, right? You could certainly say, well, maybe this person doesn't have anything related to being transgender, they just have anxiety, then that might not be true for everybody. There are many people, I've assessed people for gender reassignment stages for surgeries, and some of those people have no diagnosis at all, and insurance companies don't pay for counseling or treatment or even evaluation when people have no diagnosis at all. And so if we want to remove these things from our diagnostic manual, I think we need to talk about how we reimburse for healthcare services, but right now we're kind of stuck with it. And then the other thing I think that's really important is that we talk about LGBTQ mental health, particularly in youth, because people in this group experience higher rates of mental health problems as a protected group who are subject to discrimination and who feel marginalized, right? So we talk about this issue because these kids are struggling and they need us to be aware. Okay. So is being LGBTQ a choice? This is another question that I get often, and I think this one comes most often from parents. When I have a young person who comes in and they say that they're questioning or they're bisexual or they're gay, their parent says, I can't support this choice. This is a choice that I think is morally wrong, and I am opposed to this choice. And so I think it's important to acknowledge that in some cases, in fact, there may be some element of choice, but in many cases, there's probably an element of genetics. And there have been a number of genetic studies that support that. Research studies have shown, for example, that genetics play a role in sexual preference. And so in 2014, there was found an association between same-sex orientation in men and a specific chromosomal region that was sometimes referred to as the gay gene, okay? And so that came up as we're doing more and more genetic studies. That's one study that is well known. Family studies have shown that homosexual men have more older brothers than heterosexual men, which is interesting. And so there's some thought that there's some phenotypic expression that might change as a result of environment. So what that means is the gene gets turned on in certain situations where there's a high density of males in families. That's what this study implies. The other thing about this study that's interesting is that there was some evidence that the mother's attraction to men, the mother's sex drive, the number of partners the mother had was genetically related to the number of homosexual sons. And then homosexual men are more likely to have brothers that are also homosexual. And again, that supports some genetics that in families, homosexuality runs in families in men, and family studies show that lesbian women have more lesbian sisters than heterosexual women do. So this is all in support of the view. And I think it's important to note that in medical research and psychological research, there certainly are attempts to account for factors such as the political or social beliefs of the family, the religious beliefs of the family. So even when you try to account for differences in the belief system of the family, these differences still exist. All right, and studies on twins have established that homosexuality is more common in identical twins. This is commonly done to establish genetics. So if you have two kids who have identical genes, their rates of having the same sexual identity are much, much higher than you'd expect than compared to other groups, okay? And so there's some belief that in a complicated way, there's some inheritance involved in your sexual attraction to partners. All right, so same thing for transgender groups, that a study led by a Belgian neurologist found that brain activity in transgender people resembles the brain activity found in people of their identified sex. In other words, and this is something that we know, that I've heard people say, the brain is not male and the brain is not female. People write books and they say, oh, the female brain and the male brain. But raise your hand if you're a parent. Okay? Raise your hand if you're a parent of both female children and male children. Right? So how many of you who are parents of both female and male children think that they were just different as small children, separate from any parenting or any input from you? So I would say this has been true for me. As I watch my children, so I have 3 children, a boy, girl, and when we got to the 3rd child, who was my first girl, the thing that was really striking to me is that when we would be driving in the car and I could see her in the back seat, she would play differently. When she was, too young to speak, so the boys would take a car, or they'd take this item and they go, that's what they do. But my girl would hold the item and look at it and talk to it and say, I love it. And she would just coo at the item as if she had personified the item. And I think these are the kinds of things that people talk about, that, I sat in a lecture much like this when I was a psychiatry resident, and I had somebody talk about gender identity and gender expression, and that person said, this is all social. You teach your children this, society teaches them. And then I watched as a baby behave differently, having had really no real understanding of any of these social constructions. And so I think we all experience that, particularly if you've been around very young children, that girls and boys sometimes behave differently, but some of our little boys behave in a more stereotypical way that we would expect from the girls, and vice versa, okay? And again, very young, you see these differences. And so there's some evidence in these research studies that show that there are actual differences in how the brain is firing, which areas are activated in what circumstances, how intensely, where the lights come on is different, okay? And this was by MRI scans of transgender people who had been diagnosed with gender dysphoria and were children and teenagers. So this was young individuals. These were kids and teens. Okay. Okay, so then one of the other questions that I've heard is, does being LGBTQ cause mental illness, right? In other words, like, is this something that's bad for you? Does it cause depression? Does it cause problems? And the answer is no. The higher rates of mental health conditions in LGBT youth are related to psychosocial factors, such as family rejection, bullying, being ostracized. One of the things that young people who are simply questioning, which I say simply questioning because I think many young people around middle school age or early high school have questions about to whom they are attracted. Many kids tell me they're uncertain. And when those kids are uncertain, and they hear different kinds of comments from their peers, they hear jokes, wisecracks, they hear them making fun of another kid at school, they feel very alienated. So for kids who are certain that they have these differences of how they see their attraction or their gender expression, it's even more so than the average kid who just has questions. All right? And so, you know, why do we need to talk about it as mental health awareness, about LGBTQ youth mental health? And the answer is there's a lot of prejudice and bias, okay? This is a group who are kind of on the final frontier, sorry, hit the microphone there, on the final frontier of dealing with discrimination. We've been through gender discrimination in terms of men and women, and we've been through racial discrimination, passed laws, advocated for those groups, but this group has been largely left out of many of the political protections and the discussion that needs to be had about protecting them as a special population. In healthcare institutions, so I hear very often people talk about how, I mean, one of the things that I've heard, and I think there's a slide here about it, I've heard people say, my last therapist, I fired her because she thought that every problem I had was because I was gay. And I have a really great relationship with my partner, and I have a really great relationship with my parents, and that's not what I needed to talk about. But everything was shaped around this one aspect of me. And that would be like having somebody who comes in who is from an ethnic minority. They come in and their parents are Chinese immigrants, and all you want to talk about is how their parents are Chinese. And there's a whole lot going on that doesn't relate to that at all in many cases. With individual providers. So I'll tell you all quite honestly that I've been unsettled and even alarmed by some of the comments and questions I've heard from trainees in nursing, in medicine, in physician assistant school. I've been alarmed. I've heard some of these people raise their hand in a room full of peers and say, if a person with this issue comes into my clinic, I'm not going to treat them because this is against my beliefs. And it's a really interesting thing because, you know, I'm not a Jehovah's Witness, but I understand and was trained to understand that people of that faith sometimes refuse blood in terms of medical situations because of their religious beliefs. And I have never heard any professional say, I'm not going to treat a Jehovah's Witness because they believe something that I think is incorrect or I don't believe or I think is even dangerous when maybe they're parents and this is their child and I'm worried about their safety. So we have this kind of visceral response that exists as this is a politicized issue within our healthcare systems. And I think we have to recognize that people are not being given the care that they need when care is refused on this basis. In families, you know, I think that we know that this is the case, and this is maybe something we've all been talking about longer, that in some families, your sexual attraction status, gender status can lead to problems in the family. You know, don't tell grandma that you're dating a girl or that kind of stuff is really common. And then in schools, and we're going to talk a lot today about schools because as I look at the data that's available about our youth and how to help them when they feel ostracized and alone as part of the LGBTQ population, I think the biggest difference that we can make is in our schools. And so I'll talk about why that's my opinion.